Hey there, I'm Dr. Joe Nyam to LoveThatFace.com, and I'm sitting in my reception room with one of our favorite patients, Teresa. And Teresa is a patient that had a number of procedures performed at one time. We did endoscopic brow and forehead lift. We did her upper and lower eyelids. We did face and neck lift and a full face laser. So that is a commonly performed group of procedures that she had done all at one time. Now, some patients will come in and do this stepwise, but many patients want to just get it over with, one surgery, one anesthesia, one recovery. So, Teresa, let's talk a little bit. What was your motivation for having cosmetic surgery?
Well, number one, I was getting a little older. I felt fine, but the mirror wasn't looking fine. That and the fact that I had so many people telling me all the time that I look so tired because of the festoons under my eyes. So that was what I wanted to have done.
Great. And you know, that is good motivation. We don't want people to come in and say, I want to save my marriage or I want to get a promotion. You know, our best and happiest patients are patients that want to look and feel the best they can for their age. So we did a lot of surgery at one time, so that's a little bit bigger recovery than some surgery. So how did that go for you?
It was really quite easy, a lot better than I expected. I would say if I was going to compare what was the worst, probably the laser. And that was just nothing on earth but nerve-wracking. Not as much pain as it was. You just felt like you had little bugs running under your skin.
Yeah, there are different sensations, and you know, the situation is, and she's being gracious, because you know, the recovery from any cosmetic surgery is significant. And when you combine procedures, you're probably pretty beat up there for that first week. And the laser is a demanding recovery. It's not so much that it's painful. You're just swollen and distorted, and but it has one of the more demanding recoveries, but it is certainly one of the most dramatic before and after things that we do. And in Teresa's case, she did have festoons, which are these big bags that some people get on the cheeks, and we really improved that. So now that you've had this, you're through it. You've got new hairdo. I think you look great. You have always had an infectious smile. So how has your life changed since you've had cosmetic surgery? You feel better about yourself?
I feel better about myself. I really do. I think I'm looking like I feel on the inside. So they are kind of matched up. At one time I thought, oh, you're old, you need to retire, you need to go on. Since I have had the surgery, I have been promoted at work, and I have stepped into a new position, and I've done it with quite a lot of grace, actually. They're not pushing me out the door.
You did it because you're beautiful inside and you have a great personality. You know, being a cosmetic facial surgeon, there's a lot of great things, but I don't think there's any better feeling than when it's all said and done and you've performed this 3 or 4 hour surgery and somebody's beat up for a couple weeks, and you kind of go from the cocoon to the butterfly, and you see this evolve, and you see that people look and feel better. That's the absolute biggest paycheck and most rewarding part of my job. So, Teresa, thank you for spending time with us. I'm Dr. Joe Nyam too. If you want more information about cosmetic facial surgery, please check our website, LoveThatFace.com.